Once again, you are most welcome, and thank you so much for sparing your time to join us for this webinar series that we have at the AfriChild Center. My name is Timothy Opobo. I'm the Executive Director of the AfriChild Center, and it's an honor to have each one of you joining us. Thank you for sparing your time. We're looking forward to an interactive and informative session. I will start by giving a brief introduction of who the AfriChild Center is or who we are, and then we will then share a few of our house rules with regards to the webinar, and then proceed directly to hearing from our panelists or speakers for the day. We'll just have a short video that gives you more insight into who the AfriChild Center is, and then we'll return to proceed with the webinar. You're most welcome.
We are the AfriChild Center, a catalyst for change, championing the localization agenda to ensure that solutions for children's well-being are shaped by those who understand the challenges firsthand. Through African-led research, we elevate local voices, prioritize homegrown solutions, and disrupt traditional power dynamics in knowledge production. Our dedication to the decolonization of research moves beyond extractive models, fostering equitable partnerships that empower African researchers and institutions to lead the generation of evidence that drives impactful policies and transformative action. At the AfriChild Center, we are committed to creating a world where every child thrives. Our work is built on 3 pillars. 1. Generating research evidence. 2. Driving research into policy and practice. 3. Strengthening organizational capacity.
Established in 2013, the AfriChild Center strives for an Africa where child well-being is realized for sustainable development. We are positioned as a hub of African scholarship and a springboard upon which the continent's evidence needs will be met to generate African-led solutions to child well-being challenges experienced by children across the continent. Through partnerships and collaborations, the center aims to strengthen research capacity and build a kind of child-focused researchers that undertake research to inform both practice and policy to improve the well-being of children on the continent.
At AfriChild, we don't just generate knowledge, we turn it into action for a better future. The AfriChild Center continues to conduct high-quality, rigorous research that has utility for policy and practice, and at the same time amplifies the voices and lived experiences of children.
If we are able to achieve the visions that we have, Vision 2030, it's imperative that we invest in the well-being of children.
We are deeply grateful to the communities that have embraced our work and to the children whose resilience continues to drive our mission. The AfriChild Center, transforming child welfare through research and action.
So we will proceed into our webinar of the day. Just a few house rules. We have a chat feature. Please feel free to use the chat to introduce yourself, state your name, your organization, and the country from which you're streaming from. And we'll also use the chat to receive questions, so feel free to put comments and questions as we proceed with the webinar. We'll also have a Q&A session after the presentation, where you'll be able to unmute and share your question, if not already recorded in the chat, but we'll also be taking questions through the chat and provide responses to them during the question and answer session. So we'll head straight to our topic for the day, where we're looking at from the margins to the center, decolonizing early childhood care and development through refugee-led participatory approaches. This webinar today emerges from work that we are doing as the AfriChild Center in the area of early childhood care and development. We are specifically highlighting work that is emerging from our engagement in refugee settings, and are specifically zeroing in on work that we have done here in Uganda. However, we are also doing similar work in Ethiopia, and our subsequent webinar will highlight the work and the findings and learnings that are emerging from Ethiopia. So without further ado, I'll immediately move to introduce our first speaker of the day, Dr. Faminas Mugumya. Dr. Faminas Mugumya is going to give us an introduction and set the context, and also speak to the research process that we have undertaken in the work that I already spoke about earlier. We'll have more insight into the project as well. So Dr. Faminas Mugumya is a senior lecturer and researcher at Makerere University Department of Social Work and Social Administration. He is a research associate of the AfriChild Center and is currently leading two major research projects at AfriChild. One on strengthening research and evaluation capacity for evidence-driven policies and programs to improve the well-being of our children in Africa, funded by the Conrad Hilton Foundation, and also decolonizing research to prevent violence against women and girls and promote education outcomes through social work and social community partnerships, funded by the Wellsprings Philanthropic Fund. His expertise in research and policy development continues to drive impactful scholarship in child welfare and social protection. Dr. Faminas, you're most welcome. Please go ahead with your presentation.
Thank you. Thank you, Timothy, for the introduction, and I welcome everyone who is participating in this webinar. As said, today's webinar is focusing on a key theme that is emerging from a project that is aimed at strengthening research and evaluation capacity for evidence-driven policies and programs to improve refugee well-being. And so today we are touching a theme on moving from the margins to the center, decolonizing early childhood care and development through community-led participatory research approaches. And as Timothy said, we are focusing on Uganda today, but the project is taking place both in Uganda and in Ethiopia. Okay, so by way of context, we know that about 43% under 5 children in low and medium income countries fail to meet their development potential, particularly because of challenges at the community level, that's the micro level or household level, challenges at the system level, structural levels, cultural, social cultural challenges, and also largely because of policies that target these groups from the top to the bottom. And we also know that in refugee settings, under 5 children, or children at a much higher risk of experiencing developmental challenges, particularly because of the fact that they are more severely deprived, and also in a context where trauma is affecting not only them, but also their caregivers. We know also that, again, talking about where the research is taking place, that Uganda and Ethiopia in East Africa are hosting the majority of the refugees. And so this partly justifies the choice of these two sites for what we are calling a pilot project to help us examine or understand how working with refugees through a co-design could lead to good developmental outcomes that are refugee community-led. We also know that within refugee settings, and the statistics that we have now, 47% of the refugee populations in these contexts, especially in East Africa, are children. And again, just over a quarter are under 5 years. So we are talking about not a small population, we're talking about a big population of children who need to be taken care of. However, we also know that changes have happened in terms of shortages of funding to refugees. This is a current reality. The funding shortages have forced cuts up to almost over 60% in food rations. At the same time, we know that what has been happening previously, again, because of the context of refugees in terms of intervention to support refugees and children, largely survival needs have been emphasized in terms of care as opposed to developmental needs for children. Again, because of the fact that actions happen in an emergency context, although we know that, like in the context of Nakivale in Uganda, where our study is focused, we also have people or families that have stayed in this context for so long, and from whom we could learn lessons on how to work together with the communities in refugee settings to advance desired changes. Our formative studies confirmed also that what is being provided or what has been provided previously has largely been from outside of the refugee settings by the international NGOs and national organizations with limited refugee involvement, and therefore requiring the need for working more towards moving from the center, moving from the margins where refugees have not been part of the designs of interventions and have not been part of the decisions that are informing what is going their way, and largely to mitigate the effects of what has been created and what we call the dependency syndrome. This is really a key issue that we are trying to work towards departing from by engaging with these important communities, the refugee communities. So as I said earlier, our work today, our presentation today is related to the wider or the larger projects that the AfriChild is implementing. It has 2 key research questions, but today's presentation on the co-design and decolonizing research is related to research question 1 and aim 1 of the project to strengthen research and evaluation capacity for evidence-driven policy and programs in Africa, to improve refugee well-being in Africa. So the question we are looking at today is whether co-designing implementation research leads to improved ECD outcomes in refugee settings. So what we are emphasizing here is co-designing, working with those we are targeting for ECD interventions to design what suits their context. So does this work? So we are working in this context, and we are working with the communities to test what we shall be able to design together with them, being in the lead. I will not talk about the other aspect of the larger project, especially in the interest of time, because today we are talking about research and co-designing and with the refugees for outcomes that target what to them is a priority. So with this research, we are implementing it broadly in 3 phases. 1, the formative phase, and the co-design phase. And the 3rd phase is the implementation, testing, and evaluation. So we have so far moved through the first phase, the formative phase, and we are getting through the co-design phase and planning for the final phase, that's the implementation and evaluation phase. So there are 3 phases that we are going through iteratively. Even when we are at the co-design phase, we reflect and come back to understand better even what we have been able to identify at the formative phase in preparation for the co-design. So throughout these phases, there are important steps or stages that we are going through. And the first has been the ethical and administrative clearance. This is related to conventional research, but also very, very important that we do not depart completely from the known research process, but work with this to learn and see how things could actually adjust for purposes of ensuring that research impacts as soon as possible. So we have had to go through clearance at the research level through the Research and Ethics Committee in the university. This was done in Nakivale University for the Uganda case. And then the Uganda National Council for Science and Technology. This has to be a must. And then the Office of the Prime Minister administratively had to apply and seek clearance to be able to work in refugee settings. You can't proceed without this approval, and this is very important. Then through the regional refugee desk office, through the district of Isingiro, where our study site is. And then within the settlement, we also had to go through the camp commandant for approval, for introduction and approval that we proceed. But most importantly, we are happy to note that to us as researchers working in the context of decoloniality, community acceptance is perhaps the most important. If this is not achieved, then we fear that we cannot do much, even if the other levels have cleared us. And that is said for emphasis and for strengthening our understanding of the importance of decolonizing research for impact, for real impact. After all this clearance and acceptance, then our work moved to more reconnaissance visits to help us achieve effective immersion and acceptance, familiarizing with the context of research, especially the refugee context, trying to understand who is doing what in terms of ECD services, trying to establish contact with the community structures and the cultures by language and ethnicity, and of course also trying to understand how we settle as researchers in terms of the services, meeting points, meeting places, or halls of meetings, and then also for accommodation purposes, because we also really looked at discomfort as important in advancing our work. Then we moved on to enhancing our researcher community collaboration by building relationships through meetings and ensuring that this relationship is sustained and transitions into building community interest. We went on to also establish structures together with the communities, the community advisory board, to support us in progressing with the work and working with the local leadership structures, including established refugee-led organizations that we shall talk about later. We went on to continue on the needs assessment using participatory approaches, the household survey, the focus group discussions and interviews. We made sure that the community participated in data collection and also gave us feedback and translated the tools and contributed questions to this based on the issues that were together discovering with them at the preliminary level. We made sure also that they participated in data collection. Fortunately, we were able to establish that the Nakivale refugee settlement had an association of refugee researchers who were excited to find and invite to work with to support us in most of the research activities. And then, importantly, when the formative study, especially the community survey, was over, we had to collaborate with the community to disseminate and validate the findings at camp level and also at Juru zone and covering the villages, which we selected to focus our work in much more. So the communities, the community members identified actors from the youth and children to act some of the findings. And this helped especially to own the results and also to interpret the results further and build momentum for the next level which is the co-design phase, and that's where I said we are. So far, we have further enhanced the research capacity in terms of building sustainable community interest in existing community resources and existing opportunities. I want to highlight here Now and Tomorrow, who is a refugee-led organization. We shall have a colleague from Now and Tomorrow speaking later, and supporting us to enhance the work of the Community Advisory Board in terms of mobilization and also the Nakivale ECD consortium. I want to say that later on, because of our engagement, actually the actors in ECD decided to form a consortium to coordinate themselves to be able to interact with researchers like us and also support us in the work. We have also been able to have another structure form, which is largely related with the purpose, the co-design purpose. The Tubakane group, Tubakane means we build each other, we build together, is a structure that formed alongside the Community Advisory Board to support and advance the co-design intention locally. And then I had already talked about the Nakivale Refugee Researchers Association that continue to support us. We have already worked through to develop a theory of change, and my colleague Agatha will be talking about a little bit more about some of the program elements that have been being identified. And so with this, we should be going into the next final steps. That is phase 3 of implementation, evaluation, and testing of the prototype that will be generated through the co-design with the community. I want to thank you very much and hand over to the moderator.
Mugumia, and I hope that you were able to follow the presentation. We apologize. There was a bit of a challenge with the quality of the picture, but I hope that you're able to see the slides now. I also want to welcome those that joined us later. Please feel free to use the chat to introduce yourself, your name, institution, and where you're streaming from. We'll be moving straight to our next presenter. Dr. Faminas has given us an insight into the project and the work that we are doing. And just to emphasize that we are doing this both in Uganda and Ethiopia. Our focus today is what is emerging from the Ugandan side of things, and we will be sharing the Ethiopian findings later on. We will also be running a poll question to use. To answer, please feel free to use the chat to answer the poll question that will be running shortly. Our next presenter is Dr. Mugisha Mutabazi. He's a sociologist with a PhD from South Dakota in the United States. And he has been a faculty member of the Department of Sociology, Anthropology, and Population Studies at Chonbogo University for the last 22 years. And his expertise spans social theory, social organization, social deviance, urban sociology, refugees, and community development, with a specialization in livelihoods mapping and risk analysis. He's a research associate of the AfriChild Center and currently a principal investigator on two geogenerational research and learning partnership projects with the International Rescue Committee and the Norwegian Refugee Council. He's also a co-principal investigator on a project that Dr. Faminas just spoke about, the project from which these findings emerge, where we are co-designing a community-led ECD intervention in Nakivale refugee settlement in Uganda. So Dr. Mugisha will be situating us in the theoretical and conceptual framework that has informed the work that we are doing with regards to this project. Dr. Mugisha, you're most welcome.
Thank you, moderator, and thank you, our viewers and listeners, for tuning in. As the moderator has highlighted, I'll be speaking to the theoretical and conceptual issues that undergird this work. My colleague has made my life easy by pointing out already in his talk a number of issues concerning decolonization and our the mentality with which we went into this work to decolonize early childhood development and research and refugeehood in general. We start from a premise that early childhood development, research, and refugeehood are colonized, with colonization involving, as it has always been conceptualized, an imposition of a political, economic, epistemic, cultural, and moral system by a people on another for the purpose of controlling them, subjugating them, and appropriating their material and cultural resources. Ideally, colonization also includes certain psychological and political processes of othering, and ideally it is a process of establishing difference, and by which the colonizer is able to then apply colonial practices of imperialization and subjugation and domination.